Welcome to Refined Skin and Body Clinic, where we assure you of being flawless. Today I have our Dr. Chirag Kotecha.
Yes.
And our live chat today, we are talking about the science behind a glowing skin. Do you want to look flawless? Do you want to look glowing? We have the secrets, the tips, and we're here to unfold them for you. On our live chat today, maybe for those who have never met Doctor, I'm going to give him a chance to introduce himself. Yes, Doctor.
Good morning. My name is Dr. Chirag Kotecha. Pleasure to be here at Refined Skin and Body Clinic, where the topic today is about being flawless, glowing skin.
Exactly. We are looking at the science behind it. So there's an interesting facial that I've read about that you guys offer here at Refined Skin and Body Clinic. It's called PRP. So do you mind telling us what is this PRP facial about? Okay. What does it even stand for?
So before I go into PRP, I want to talk about general. Glowing skin starts with you at home. Healthy diet, no smoking, diet full of green vegetables, citrus fruits, drink lots of water, and wear your sunscreen.
Exactly.
You follow that, then this, what we do, is an addition to improve you. So PRP stands for platelet-rich plasma.
Okay.
Platelets and plasma are from your blood. These are the growth factors. So when you are, when you're created, a sperm and an egg fertilize, and what happens is that from one cell, that whole human body is made. Hair, skin, everything. So that stem cell is there, active in there. And platelets in plasma help bring in growth factors. Growth factors is what helps things grow. Let's put it simply that way. So by doing the PRP facial, where we take your blood, put it through the machine, the centrifuge, and get your plasma, we can then inject it or microneedle it onto the face. Microneedling, we create small channels, and then we put the plasma on top. So what that happens is your body's growth factors come and start creating new skin, closing up pores, getting rid of pigmentation, making you look younger, removing wrinkles. So there's many, many benefits. It's using your own body's healing factors, growth factors to, in a correct way, to stimulate a new skin.
Okay. So how, if someone came to the clinic to get this service, how long would it take for this process for this procedure to happen?
Well, first of all, consultation time. After you've understood the procedure, you come in, we take some pictures. That will take a few minutes. Then we'll put anesthetic or numbing cream on the face after the face has been cleansed.
Okay.
We'll normally leave that cream on for about 30-40 minutes, during which time your blood is taken, processed, and then the treatment is done. Now, the treatment can take anywhere from 15 to 30 minutes because we look for what are called endpoints, where there's some microscopic bleeding or a little bit of bleeding.
Okay.
So that means the channel's open, so depending how deep we need to go or how many times we need to go. If it's for scarring, like we might need to go multiple times.
Yeah.
Then after which we put on a mask under an LED light to help heal the skin. So all in all, you're looking at being here for about 90 minutes.
90 minutes, an hour.
An hour and a half.
An hour and a half, an hour and a half, okay. So, since the process, from explanation, the process involves a lot of, needling. I'm imagining you're piercing the skin. Are there any side effects that one should expect? Or is this something that someone should follow after the treatment?
So
those are two questions, actually.
So the side effects, yes, there is possibility of post-inflammatory hyperpigmentation.
What does that mean for someone?
Does that rebound pigmentation? The skin gets darker. That's scarring. Because if you go too deep, or for example, if the settings are not right, done by an untrained person, they lead to scarring. And it's happened to us also. It happens everywhere. If you've done enough cases, you come across things like that. You've got active acne. You can spread acne. So if you've got pimples, we can use it for treatment of pimples. Previously, the thought was not to do PRP when you've got active acne, but new science shows you can do it because it does help heal. But yes, it can also spread acne. So some people have a mild rash after for a few days. Post-treatment care, sunscreen, very important.
Wow.
Your active ingredients, whether you're using vitamin C, retinol, has to be there. Retinol has to be stopped 3 to 5 days before you come in for a PRP treatment.
Okay.
And then you might need repeated treatments once a month. For about 3 months, then maintenance once a year. We all get old. we don't stay young forever. So if you want to maintain the skin and using your own body's healing factors, PRP every now and then is important.
Okay. Are there any skin types, when we come to the question of skin types now, are there any skin types that shouldn't go for this treatment? Or is it for
PRP is safe for all skin types. Like I said, all we have to control is the depth of the needling. If you go too deep on, say, darker skin, you might end up with hyperpigmentation or darkening of the skin. So, but it's safe. It's your own body's healing factors. You're really using just magic of your own blood.
Okay. So in your explanation, you mentioned that this PRP treatment, in order to get the best results of it, you have to, drink water, sunscreen. If someone has maybe eczema, and with people with eczema, they need some treatments that they need to be taking for their daily routine. So when someone has undergone this PRP facial treatment, is it advised to combine it with other treatments that someone can be has been taking?
If you're treating eczema, you're using what you call emollients, thick sort of barriers to help hydrate the skin, you can still do PRP. Provided you continue with those treatments of your eczema, the soap that you use, the moisturizer you use, it's soap, because the eczema you're not supposed to really use normal soap. It's a soap alternative.
Exactly.
So you can combine it.
Okay. Now for our last question, are there any conditions or concerns that PRP facial treatments specifically address? From your explanation, we have understood that this PRP treatment, we are using the body is healing the body, yeah? But are there any specific concerns that, any specific skin, can I say, illnesses that PRP treats?
So I do a lot of PRP for acne scarring. So if you've got scars post-acne, I do it for hair loss. So if you want to grow your hair, I've actually done myself a few times. I need to do it again. So it shows that the repeated treatment's needed. So those are the two big indications we use it for. But I do use it for anti-aging purposes. So what is called the vampire facelift or vampire facial.
Okay.
We do that. So where we take your blood, microneedle it. So those are three big indications: anti-aging for wrinkles, acne scarring, hair loss, and pigmentation also.
And pigmentation.
So we use it for pigmentation, where we combine different cocktails with the blood. We put in some mesotherapy, what you call mesotherapy elements, multivitamins, lightening agents for that.
Then, as we close, is there an age limit or a certain age in which someone should qualifies to have this sort of treatment? 18 and above?
18
15?
and above, really. It's your own body's healing factor. So you can handle the pain or the downtime, because there's a 1 or 2 days downtime sometimes with the treatment.
So even if I'm 16, I can come to Refine and get
Well, I don't
PRP.
really start at that age unless you've got real bad acne scarring or any medical concerns. But at that young age, you should already be using sunscreen.
Really?
Please, yes. I mean, my children get sunscreen from now.
Yeah.
We're seeing a lot of UV damage, pigmentation, which was not being evident in the past.
Yeah.
So we need to use that from the
Exactly, especially because, around 16, 15, someone is in their adolescence. So, of course, these changes like, a lot of acne coming due to hormones.
Correct.
Someone be like, hey, I should go to Refine to get this vampire thing. So that's what I'm saying. Like,
they come in for treatment at that younger age. See, PRP facial is a bit more expensive. This is straightforward acne treatment. So we ask them to come in and treat your acne. Don't wait and think that it's going to go away. Don't go to the pharmacy. People say, I didn't want to pay the doctor's consultation fee, but I've spent 1 year trying this medicine, that medicine from the pharmacy.
And that would even be so much. Yeah.
Just come to the doctors for that consultation, get that advice you need, are using the right medication, because remember, prevention, before the damage comes, the scarring and everything comes, and the pigmentation, it's easier to treat the acne early on.
Is this treatment only found at this branch, or it's also in other branches?
The PRP facial is available at all our branches.
At all our branches. Thank you so much, Doctor, for your time and unfolding and dissecting this topic of PRP facials. I have learned a lot about it, and sure, when I get my free time, I'm definitely coming for the PRP facial, and I'll give you my reviews on it. Thank you so much for joining us. If you have any concerns, any comments, any questions, you can call the Refine line. You can come to the different branches of Refine Skin and Body
The
Clinic.
website is the best.
The website is the best, right from the straight from the host's mouth. The website is the best. You get all the contacts you need. You can book an appointment through the website. Exactly. Thank you so much for joining us, and have a nice time.